Greetings! It's time in the process to discuss the excess skin and some of the questions that you might have. Will I need surgery? What are the payment options? How do I choose a plastic surgeon? Is there more than one surgical option? And is it worth it? Let's start by discussing what is excess skin. Well, as you lose weight rapidly, you might have stretch marks or have your skin draping down in folds. You might not like how it looks, and you might have rashes, which is usually a yeast infection within the folds. However, not everyone who has excess skin will need plastic surgery. There are many factors that will affect whether you need plastic surgery, such as age, how much weight you've lost, your skin type, if you've ever smoked, because smoking is very bad for your skin, and if you've ever been exposed to a lot of sun, which makes the skin less elastic. Exercising regularly will help tremendously. It will give you well-defined muscles under the skin, filling out the sag. Hydration is very important for your skin too. Don't forget your 64 ounces every day. And it's super important not to have plastic surgery too soon, because if you lose more weight, your skin will start to sag again. In other words, once you've completed your weight loss journey and your weight has been stable for a few months, that's a good time to proceed with skin removal. Now, until you get your surgery, you can shop for different elastic or spandex body shapers, which can really be effective. The next question is how to choose your plastic surgeon. You might be most comfortable sticking with your bariatric surgeon for plastic surgery. Some bariatric surgeons do have extensive experience with skin removal. But keep in mind that your bariatric surgeon is not a plastic surgeon, so the results might not be perfect. For the best results, have your surgery performed by a plastic surgeon who has experience working with weight loss surgery patients. You can ask your bariatric surgeon to refer you to a good plastic surgeon or ask for referrals at your support group. Now on to price. I suppose it goes without saying that plastic surgery is usually costly. So how can you get the expenses covered? Usually insurance companies do not cover plastic surgery if it's cosmetic. They might, however, cover the procedure if it's reconstructive surgery for medical necessity. Some of the reasons for insurance companies to cover the surgery are if you're having recurrent rashes or infections in the skin folds, or the excess skin is inhibiting your ability to walk or have a normal life. And finally, if the weight of the pannus, which is the large flap of hanging skin of the abdomen, is causing you back pain. Now, even if your insurance doesn't cover the surgery, check with your accountant as the cost might be tax deductible. Also, some plastic surgery training programs might offer lower prices for the surgery. Endpoint: do your research before you choose your plastic surgeon. Next up, possible complications and surgical options. First, you should know that the procedure will most likely be more painful than your weight loss surgery. Some of the possible complications include seromas, which is a collection of fluid under the skin. This accumulation can usually be drained by a needle in the office and often are not a big problem. Just like any surgery, bleeding is possible. Poor healing of the wound or infections are also a possibility. And finally, there is a chance of blood clots in the legs, which can sometimes be serious. And your surgical options include panniculectomy, which is removing the pannus, mentioned earlier, or abdominoplasty, which is also called tummy tuck. This is more extensive and involves tightening of the muscles of the abdomen. Other surgeries include brachioplasty, which is removing the excess skin from your arms, a lower body lift, a facelift, or neck lift. Also, liposuction is used to suck out fat from under your skin with a long tube. However, liposuction doesn't help with the sagging skin, but does help to smooth out your skin in specific areas. Regardless, no matter which plastic surgery you choose, you will have a lot of puffiness afterward, which might take 2 to 3 months before it's gone and you see good results from your plastic surgery. Still, skin removal surgery after bariatric surgery can be a transformative experience, both physically and emotionally. It can be the final step in achieving the body you've always wanted and a way to finally feel comfortable in your own skin. It takes courage to take this step, but the results can be life-changing, giving you the confidence and freedom to fully embrace your new, healthier lifestyle. Sounds amazing, doesn't it? Fantastic. When you're ready, I'll find you in our next lesson.